Change it had to come. We knew it all along. We were liberated by the fold, and that's all.
While bankers are earning six-digit bonuses, healthcare workers are being asked to take 0 and 0 and pay for this recession, brought on by corporate greed and irresponsible financial services that put the government in the red, not healthcare costs. Healthcare is as sustainable as we want it to be. And this election is whether we need to decide whether we want to put more money into big corporate tax cuts or whether citizens of Ontario and your families deserve the health care that we know that we need.
Oh, we be walking, we be marching, we be on the side of right. Yes, we are. All we need is
Don't let them tell you it cannot be done. Yes, we can deliver good quality public health care in this province. We can do it with frontline workers earning a decent wage and a decent salary. Let's fight government for good, decent health care in this province. That's something that we should be demanding of ourselves as well as demanding of politicians.
I speak here today to raise my concerns to how the NHS mishandled my mother's health care. Why, after going to the hospital 4 times with the same symptoms, and not until June 14th did they finally test her for C. diff. This was not the fault of the public not washing their hands or the performance of the frontline people in the hospital, but of the top administration in the NHS who decide how to spend the budget.
Right on.
The cuts, the secrecy, and the bad decisions are what contributed to the outbreak in Niagara.
In Niagara Falls, although we weren't told by the LHINs, we weren't told by the NHS, that 4 people died in our hospital in Niagara Falls from C. diff. They felt they didn't have to tell the residents. And we put a rally together to force them to tell us. Healthcare is the #1 issue in this province.
There is an injustice in the province of Ontario. So today on behalf of the CAW and the many retirees that are here today and active members, we work together for universal publicly funded health care. And I say to the Ontario Health Coalition that our health care would be in more dire straits today if it wasn't for the activism 365 days a year demanding justice for those that we serve each day and represent those that work in healthcare with respect and dignity. When politicians knock on your door, you've got to ask them, are you going to stop the bleeding of privatization? Are you going to let the corporate community make money on the backs of the disabled and the frail and the ill? Speak up for justice. Speak up for fairness. Speak up for decency. And speak up for the common good that bonds Ontarians, and that's universal, publicly accessible health care. Thank you very much.